If we're going to use some scriptures this morning, and we're going to in a minute, but you might want to be looking it up. Philippians 4 will be the first passage we're going to be looking at. Philippians chapter 4 will be the first one we're looking at. If you have your handout, you have the symptoms of depression, and then you have the symptoms of anxiety, right? You should have that. One sheet. Sometimes you got to be a little careful when you start looking at these kind of things, because some people, when you start naming off symptoms of any illness, after you finish naming them off, you got it. You know, this is what it does, especially depression, because after you read all the symptoms, oh my. But anyway, here we go. Depression has 9 symptoms. It's a depressed mood most of the day and nearly every day. All of the 9 are most of the day, almost every day. All of the 9 symptoms have to be most of the day, almost every day. You can't have sadness one day and then 3 or 4 days later, you know, be fatigued and so forth. No, all of them have to be there at one time. And it has to be for at least 2 weeks. If you felt this way yesterday and you haven't felt that way before, we can't give you a diagnosis. We have to wait almost 2 weeks here. Okay, so you're sad almost all day, almost every day. Sad almost all day, almost every day. You have diminished interest in pleasurable things. You don't like to do anything that's fun anymore. What you used to like to do, you don't have the energy or the motivation to do it. And this one, some people would like, the significant weight loss. Yeah, 5% of your body weight in less than 30 days without trying. You'll do that when you have the baby, right? 5% of your body weight in 30 days without trying. Or you gain, you don't like that one, 5% of your body weight without trying. Of course, we don't have to try to gain weight, you know. The adolescents have to try. Us, we just look at food and here we go. Alright, so then you either sleep all day because you're escaping in sleep. See, when you're sleeping, nothing's happening, nothing bothers you. And some people that are depressed, they close the drapes and they're in this dark room and that's where they want to stay. Or you can't sleep at all. You go to sleep and you wake up and it takes you 30 minutes, an hour to go back to sleep, and you toss and turn, etc., etc. And number 5 is psychomotor agitation or psychomotor retardation. Psycho is thinking, motor is body. So your mind is racing, worrying, working, making plans, and interferes with sleep. Or the opposite of that, your mind doesn't want to do any of these things. Lethargic thinking, don't want to think, don't want to worry, leave it alone, don't bother me, and so forth. And then fatigue almost all day. This is no matter how, if you get a good night's sleep, doesn't matter. If you rest all day, doesn't matter. You're still tired and fatigued. And feelings of worthlessness, you don't feel value at all. Or you have guilt, heavy, inappropriate, and probably unrealistic guilt. You feel guilty for things you shouldn't feel guilty about. Okay, also you have difficulty concentrating. You have to reread things. Of course, if you pass 60, that's just the way it is. Don't worry about it. But other people, you read something, you used to be able to hold on to it. Now, what did I read? Or forgetfulness. I mean, but again, you know, you got to look at the age. I mean, I get up from one room and I'm going to the other room to get something. I'm at the entrance of the other room and I stop. Why am I here? And I started looking around. Why did I come here? And I asked my wife, she says, I don't know, you just got up, you didn't tell me. But after a while, oh yeah, here we go. And sometimes it's all gone. But generally speaking, depression, like one time, I've been through all of that. And back in the back, there's CDs over there in the back, seminars like this one, and there's one that I gave on the radio about depression and anxiety. It's back there, my experience and so forth. I had depression, I had anxiety. I was on medicine for 5 years. And I remember going to the bakery in San Antonio. They have this panaderias, and they got them here too. And you have all these things. I just stood there and I couldn't make a choice. I could not choose even one. My mind it was too much, overwhelmed to make a choice. That's what happens with the diminished ability to concentrate, and you forget things, and can't hold on to information like you used to. And then the last one, is thoughts of death. That doesn't mean suicide necessarily. That means that you're saying, life is too hard, I'd rather not be here. I want Jesus to come today. You know, I say that too, but I don't fit that one. I say it for other reasons. But you think about death, that's a good thing, you know, escape. I want to get away, leave me alone. You're not planning how to take your life, but you sure don't want to live anymore. Your life would be better without you, so would your family, etc., etc. Now, by the time you see depression in children or adolescents, it is serious. Not so with an adult. When you begin to see it, it's probably just starting, you're looking at it, okay, but when you can spot it, see it, in a child or an adolescent like any of these guys here, it is serious. It is serious, so you take it serious. I mean, you just run to the counselor, to the doctor, whatever, because it's not a, they don't show it. And when you can see it, it's really bad. I'm going to get to medicine in a little bit, but like I say, I forget things, so I better tell you now. Prozac for adolescents is not a good thing. Antidepressants are good, I recommend them, but Prozac for adolescents is not a good thing because somehow or other it works quickly on them and their energy returns, their ability to concentrate returns, and then they take their life. So you want to get away from Prozac for adolescents if you're in that arena. Okay, you have to have 5 of these symptoms in order to be given a diagnosis of major depression. No, there's no minor depression. That's the name of it, major depression, that's the name of it. Some people say clinical, same thing. So, let's see. Does anybody have 5 of these? Let me see your mano. You have 5 of those? Anybody else? Over there? You did something. Yeah, the girl in the middle with the pretty hair. You did something. Anybody else? Or you don't want to admit it, right? Not me, man. I'm a man. I don't have this. Men don't go to doctors. Did you know that? We might walk by the drugstore now and then, but we don't go to doctors. And you know, women outlive men by 8 years. And they go to a lot of doctors. So maybe that tells you something. I don't know. It's time for your physical. No way. All right, that's depression, okay? Any questions, comments on what I've said so far on depression? Questions, comments, objections, criticisms, whatever.
Besides therapy,
start over, please.
I said, besides therapy in a young person, a very young person with depression, is medication ever?
Yeah, it is. We really don't like to put a person on medicine that's 5 years old, 9 years old. But sometimes you don't have any choice. There's a lot of natural things, but the natural things will help with mild to moderate. And like I said, by the time you see depression in a child or adolescent, it's bad. So I really, really don't like to do that, but we've done it. 5 years old, 9 years old, because they're miserable. What are you going to do? I mean, you don't want to do this, but that's the way it is. By the way, Ingo Taphoven says hello. He's in Germany. I don't know if you remember him or not. He's my wonderful son-in-law who married my daughter and took her away to Germany with my grandchildren forever, he says. We went over there last April, my other daughter and her children and I, and we had a wonderful time. I just really, really miss them. They're in the right place. They're doing wonderful ministry. I mean, he fits, you know, because he's German, but he's also American because he's been here for so long. So he really fits in the environment that he's in. Anyway, he says hello. Yes.
Criteria. What is it? Maybe causes.
Yeah. Yeah. I'm supposed to tell you that. It's in my notes. Sorry. I'm glad you brought it up. See what I'm saying here? Okay. Let's go there now. Causes of depression basically is loss. Okay? Loss. Loss. In Spanish it's pérdida. It's a nice word in Spanish. Loss. Loss of what? Well, examples. Death of a loved one, loss of employment, loss of health and or youth, that's a whole bunch of us, and children leaving the nest, or children leaving God, or both, and abuse and trauma, loss of different kinds. I just named a few. You lose something, like, goodness gracious, I mean, I love to play with my grandchildren. My grandson, he's the one that's here in San Antonio, he's 12. We buy these Nerf guns, to shoot these Nerf darts. And I went and bought him a machine gun Nerf gun. And he gave me one-shot Nerf gun. And so we had a battle. Of course he won. And I'm running away from him. And after about 5 minutes, okay, stop. Because I just can't run like that anymore. What have I lost? I've lost my youth. I've lost my ability to keep up with these guys. And I've lost I used to run 6 miles a day. Oh man, I run maybe 5 minutes now. And everything hurts. So you lost. So what are you going to do? So loss of all kinds of things. But abuse is a favorite one. Death of a loved one. Divorce also. Loss. You lose the parents and so forth. The divorced father gets remarried. The child has now lost the only hope the child had of the mother and father getting back together, and they always want that. They're not thinking rationally, you might say, but that is what they want. Okay, loss. And the other thing is heredity. Depression has more heredity in it than anxiety does, but they both have some. But heredity. Your mother, your father, your grandmother, your grandfather had depression. Now, you might have heard about chemicals, right? Norepinephrine, dopamine, serotonin, etc., right? Lots of people say that depression is a cause of a chemical imbalance. Maybe they're right. I say it the other way around. Depression causes a chemical imbalance. When you've had depression for a while and it's a serious depression, you will have a chemical imbalance. But that's not what caused it. Some depression, heredity kind, only alone by itself, can be a result of chemical imbalance, and that's it. But that to me is in the minority. All of the people I've seen, it's because of these other things I'm telling you. They have these loss of self-esteem, self-worth, the trauma that's occurred to them. Some people have gone through 4 or 5 surgeries in a row, and they've never recovered, and they have depression as well. And lots of different things, but loss mostly. Okay, any question here that I'm talking about? Causes of depression. Any question here? Causes of depression. Yes?
I recognize both of these. I guess I can tell you I've been through it. I'm wondering if insecurity comes there.
Oh yeah.
I don't know why, but that always seemed to be
Yeah.
where I ended up. I never,
Yeah.
I always had good work, I never lacked, but it seemed like I was always a little more.
You would almost, insecurity would be there, of course, but it's more likely that the insecurity was because of the anxiety. Depression and anxiety always go together, and the anxiety will give you an unsure feeling. So yes, depression can cause it, but I would put it more in the category of anxiety, which goes along with it. But yeah, it's not a symptom, it's a result, but it's there. And you had a question.
Do you think it's right for people who have extreme depression to have medical marijuana prescribed to them?
No. No. Keep going. You have more to say?
Oh, yes, okay. So I was wondering, because as far as in society, we're supposed to be okay being drug addicts. We all drink coffee, so if you look at the dictionary, it's considered caffeine, so it is, so I don't think it's wrong. I have friends who are depressed and they smoke marijuana. It comes from that, it doesn't make them violent. I just wanted to...
You have a little more experience with it than I do, because I don't deal with that population anymore. I used to. I did for 12 years, but that's been a long, long time ago. So you have more recent information. My reason for saying no to use of marijuana is that, like I said before, when you have depression and you have it long enough, and that could be a few months, there is a chemical imbalance that happens, and the marijuana will not touch it. It will not touch that. And so this person is going to have to keep smoking it, or alcohol, or any other kind of feel-good thing is going to help them feel good for a little bit, but it does nothing for repairing the brain. That's my reason for saying no. Same as the herbs and stuff, they help, but they again do nothing for the healing of the chemical imbalance in the brain. You've got to go to these medicines for that. Okay, other questions? Yes.
Going in hand with what you're saying, when you look at your female adolescent versus your young male adolescent, you know that the brain research, we already know that a female, of course, matures faster than that young male. So knowing those circumstances, what are some of the things that you've seen are some of the best practices right now?
Some of the what?
Some of the best practices in helping that adolescent. I mean, I know it's therapy, but what are some of the things as a parent that we can do to support the female versus the male? And we know that they're experiencing.
Hey, Pastor Adam, you didn't tell me you'd have experts in here, man. I don't work with adolescents anymore. I used to when I was younger. I can't keep up with them anymore. And I don't know their latest songs and their latest groups, and so they tend to shut me off. I know what to do, and I can read them, and I can diagnose them, and I know what they need. But as far as rapport, it's kind of lost there because I'm an old granddad now. But to me, and this is my theory. It doesn't have to be right. You know, I'm one person. I can make a lot of mistakes. My theory that I work under is that therapy is getting inside the individual and getting out the stuff. You can call it barriers, you can call it obstacles, you can call it memories, past, whatever it is. The stuff inside the person that is preventing them from going forward into the blessings of God, joy, peace, etc., productivity, and so on and so on. So to me, therapy is what I do with whoever, children, adolescents, adults, whatever. I don't use what you just said, either because I'm ignorant of it or because my thing seems to work. But, you know, I really wouldn't do anything different. I would notice that the girl can articulate a whole lot better her feelings than the guy. That I do see. But as far as using different entries to a girl and a guy, either I'm not that fine-tuned, or I don't need it, or I don't know about it, but I can't go where you're going. I'm sure there's something there because of what you said.
It's because, I mean, I see it now. I've done secondary ed for some time. And these last 2 years, I have seen there's really a difference in working with a female. But I also see where there's an enormous concern right now for that male, where they turn to other things because they don't actually have that dialogue. And they keep a lot of things built up inside that male.
But a lot of not having that dialogue is because they don't talk. They don't want to. And the girl is a natural talker. You know, so you got that. Well, but by the time they come to me and sit in my office and start charging them a fee, they're not going to mess around because they're there. And they're paying me a whole lot of money. So I'm the most expensive therapist probably in the valley. And I help them immediately. So they're gonna move along here. So I don't deal with the population you're dealing with. I have, but that was in the 70s and the early 80s. That was a long time ago. All right, other questions, comments, or complaints? Yes?
On depression, is it a short-term or long-term illness?
Goodness, they're asking really good questions. Make me think over here, man. It depends on who you're talking to, and depends on what long-term, short-term means. With me, if a person is motivated, which they usually are by the time they come to me, it's 6 months to 2 years of medicine, not necessarily that long for therapy. We can say therapy would be 6 months to a year, but not every week. We start once a week, and then when they get better, we go to 2 weeks, and then when they get really good, we go to once a month. So we may keep them a year, but it's not that constant anymore. Depression is really easy to solve. It's not that difficult. Depression is curable, so is anxiety. Depression and anxiety are completely 100% curable, not just treatable. And that's what I believe, that's what I see, that's what I know. And I guess from what I remember from school and the textbooks, what I'm doing would be called short term. That's what they would call it technically, because you're talking about months, not years. And the medicine 6 months to 2 years. So I guess we'd say short term to answer that one. Any other questions, comments, whatever? Yes?
Sometimes people are depressed and
whenever I see somebody and I diagnose them with any kind of anxiety other than generalized, and then depression, either one or both, I do recommend medicine, because it's so hard for the person to do what they need to do. Therapy is going to solve it, but medicine takes away the burden. Medicine takes away the artificialness, the exaggerationness. It takes away that heavy thing that's there, and they can move about in the things that they need to do in order to get past it. But yes, I do recommend it. And a lot of people don't like to take it, especially believers. And what else did you say after that? Antidepressants are not addictive. Now, tranquilizers like Xanax, Valium, there's another one. What's that? No, that's not addictive. Use another word for that one. There's another one like Xanax, but it escapes me. But it's the same field. It's benzodiazepines. They are addictive, and people do get addicted to it. However, for a person to become addicted, something else has to be there. They have to have the character, the personality for addiction to occur. It's another seminar that I do for loved ones of people who are on drugs, using drugs, addicted to drugs, etc. Not for the drug addict and not about the drugs, but about the character and personality.
What about heredity as far as addiction is concerned?
They use another word. It's called tendency or there's another word, maybe you know it, predisposed, that can be in there. And just like an alcoholic, I mean, one guy can take a drink of alcohol, he's okay. Another guy takes it and all of a sudden he's got this craving. Yes?
Is that a nature versus nurture?
Yeah, it's always both, nature, nurture. I mean, there's heredity. Well, even like, I mean, why do I put my forehead on my hand and say, oh my, because my daddy did it. Yeah? Why does Junior say that word or use that language or use that tone or have that facial expression? Because his granddaddy did it. And so on. So yes, there's nurture and just about, heredity, just about anything you want to mention. But for addiction, to me, it'd just be a propensity. It wouldn't necessarily be I inherited, because the only way you can get it is to involve yourself in taking the stuff.
Yeah, it's a choice to start it.
It's always a choice. But the guys who have the propensity, oh man, it's a whole lot harder.
Is it the propensity?
That's the way I would use it.
Heredity.
That's what I would say, yes. I would put it in that category. And you see them all the time, and AA talks about it, and the doctors talk about it, so it's there. Other questions, comments? Yes?
You were saying depression is hereditary, so as well maybe anger is hereditary?
I'm not saying it's hereditary. I'm saying there's an ingredient of it that's hereditary. I'm saying the 80-90% of it is loss, the life. But go ahead.
Even if there's even a small degree of hereditary within these illnesses of depression and anger, should we really pray to God for forgiveness and put it within us?
You see, you're in a little gray area there. I'm saying that the genes are everywhere, and we can inherit genes and propensity for this and this and this and this, including anger and so forth. But when you look in the Bible, addiction, anger, adultery, lying, all of those are sins, and regardless if I have a heredity or not, I don't have to do it. I can say no, and I can learn to be disciplined and discipled by God and not do it. So technically, I would say, yeah, you're right. There's some things in there there's got to be. But then God says, don't do this, okay? I can stop, or I can never start. Okay, let me keep going. Depression is a mood disorder and not an illness, is what I'm saying. Not a mental illness. You can call it an illness as long as you're not saying mental. It's a mood disorder. You look in the DSM, what is it now, 4 revised, and I think they came out with another one now. It is a mood disorder. It is not a mental illness like schizophrenia, bipolar. Schizophrenia, bipolar, there you're talking about mental disorder, mental illness, and psychosis and so forth. But depression and anxiety are a mood disorder. That's the way I describe it. That's the way I believe it. It is, you can call it an illness, like you call the flu or whatever, but not a mental illness. Question to you. Is depression sin? Any yeses? I would say no, but it can cause sin. You can get into sin. And I would also say that sometimes, not always, because it's loss as well, sometimes sin can bring on the depression because of the heaviness of sin. Person having an affair, and she thinks they haven't been discovered, and it's gone on for a few months now, and they're getting really anxious about it, and they want to stop it and they can't because the other person doesn't want to. Talking about a lot of stress and a lot of pressure and a lot of loss of freedom and innocency and righteousness. And I have seen that. I've seen people have panic attacks, and the main ingredient was an affair. So sin can be before, after, but by itself, I would say no. And you still, I mean, you could still move into it in a different way if you wanted to. But for instance, remember Elijah? When he had this contest on Mount Carmel, where he had the 400 and something prophets of Baal and so forth, and he had great victory over that. The God that answers by fire, let him be God. And then he ran away from Jezebel. At that point, he was beginning into depression. He went into the brook, and the ravens, I think, fed him and so forth. And he was saying, woe is me, I am the only one left, and I want to die. So I'm saying, yeah, it kind of looks like depression there. But then you go over to Jonah, and to me, Jonah had a whole bunch of things going on there. You could even say maybe he had depression, and his was sin. See, he did sin against God and refused to go where he was supposed to go, and then he refused to accept the grace and mercy that God gave the people in that town. And so, yeah, it can move around in there. But generally speaking, depression is a result of loss. And we can do all kinds of things for it, and some sin can be categorized as loss, and so that brings on depression. But the actual depression, the feelings, the symptoms there are not sin by themselves, but sin can be involved in there. Okay, and the treatment for depression is medication and therapy. When do I have to finish?
At about 9:45, 15 more minutes.
10:45?
10:45, yeah.
Okay, treatment, therapy, which is, just to kind of give you an idea, the therapy that I do is talk therapy, and it's the expression where the person expresses the stuff that's inside them that gets me to see inside, and that relieves them as well. To express completely, not vent, that's different. To express systematically will relieve some of the problems just through the expression, will weaken others, plus it gives me an insight as to what is going on in there. And then we move to resolution. So I have two big categories, expression and resolution, that I get into. Let me move to anxiety before I run out of time. Symptoms of anxiety, you have there, right? The panic attack is the granddaddy. A lot of people start with the other one, generalized anxiety. So you have restlessness, easily fatigued. This is different than fatigue and depression. Fatigue and depression is always fatigue. This one is easily fatigued. You get up okay, but then you easily get tired. Difficulty concentrating or mind going blank, same thing as up there. Irritability and muscle tension, could be headaches, muscle tension in the back of the neck and so forth, and sleep disturbance. Some of them are very similar to depression, but they're a little bit different. Irritability, a person gets irritable, angry right away. That could be a whole other problem, but this is a symptom of generalized anxiety. Whether the person expresses irritability or not, it is there. And then you have the panic attack, palpitations, pounding heart, sweating of the hands and feet, trembling or shaking, sensations of shortness of breath or smothering, feeling of choking, chest pain or discomfort, nausea, abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, derealization or impersonalization, meaning that you're here, but you're kind of outside of it, and things are happening without you. It's kind of like an out-of-body experience type of thing. And fear of losing control or going crazy, that's what you fear. Fear of dying. I don't know what that other one is. That's, somebody put it there. Chills or hot flushes. Okay, do you qualify for any of these? Yeah, without getting too far ahead of myself here, I'm going to give you something else. On this stuff. There we go. In order for a person to have anxiety, now depression and anxiety go together. In order for a person to have anxiety, they've got to have certain things about them. Anxiety has a different cause. To me, depression and anxiety always go together. But if it's loss for depression, then that's the main one. Anxiety is just tagged on and we treat it differently. But if it's the major diagnosis, then it was caused by burdens or being overwhelmed for a long time. Being overwhelmed, burdens for a long time. That could mean all kinds of things. Like I said, surgeries before, responsibility. The oldest child in the family, the father dies. The oldest child quits his or her college, goes to work, puts all of the siblings through high school and college, and after they graduate from college, he's still responsible for them, carries them. Now they're 35 years old and he's still providing for them. That's overburdening over responsibility. Overburdening of all kinds of different things. But then sometimes a person who has panic disorder is a perfectionist. Do you know what that is? A perfectionist, perfeccionista, a perfectionist. What do they do? The what?
Nothing's ever good enough.
Never. What's never good enough? Nothing's ever good enough. Choir director. The what? Rearrange. Well, that's a woman thing anyway. You know, they do it anyway. But just so you can sit down on the wrong place. Choir director introduces a new music to the choir that has 30 people in it. Everybody likes it, except one person. So the perfectionist choir director failed. It was a disaster. Because one person didn't like it. That's just a picture of a perfectionist. A perfectionist never arrives. They're always en route. Because maybe you get a little feeling of I accomplished this, but then there's another one. You can't ever stop. And the perfectionism is defined by the individual, not by the ones around them. Also, a type A personality. You know what that is? You ever hear that? Type A, right? Almost the same thing. Let me read some of it to you. A type A person is highly driven, competitive, impatient, aggressive, and the women say, I married one of those guys, man. Feels rushed, under pressure, keeps one eye glued to the clock, not because he wants to quit, but because the clock is his enemy and is going too fast. And he won't finish, or she won't finish everything that they want to do. They are prompt or early. Eats, walks, talks rapidly. Right? Medical doctors, goodness gracious, they can gulp down a hamburger in seconds, man. Restless among slow workers. I mean, you just, what's the matter with you, man? Dominance in discussions. You dominate a discussion. I mean, you can be in a group and they're talking and man, you got it. Nobody else talks but you. Reluctant to delegate authority. And that increases their own workload. Accentuates the negative. And self-critical. These are some of the characteristics of a type A. Type A is not a diagnosis like depression. Perfectionism is not a diagnosis like depression. It is just a way of trying to explain what's going on inside the mind of this person. A person who has panic disorder almost always, there's exceptions to everything that's not in the Bible, almost always they are very sensitive. They care about people. They may even be people pleasers, but they do care about people. They don't have to be people pleasers. Sometimes they are, but they care about people. Then they can read people. Emotionally, they can read people. They walk into a room and they feel the anger. or they feel the whatever. Everybody else, I don't feel a thing, but that person feels whatever is going on there. And they're also are very sensitive to input, words, noise, crowds, people, lights, whatever. Input affects them much stronger than the person who doesn't have anxiety. And so this kind of person, you put burdens and responsibilities and overwhelming and trauma and etc. on them that overwhelms the system, mind, spirit, emotions, brain, constantly. Eventually you're going to have what, when I was a little child, used to be called the nervous breakdown. Now we came up in the world and we call it a panic attack. Same old, same old. You're out of it. Forget it. You're afraid of this, afraid of that, and so forth and so on. Questions or comments so far? People who are not experts or professionals. Questions or comments? Yeah.
So is panic attacks hereditary and do they ever go with?
Just like we've been saying here, you can put everything under that heading. But let me tell you what I see. Whenever I see a person that has anxiety, not necessarily generalized, the other kinds, and I'll name some other kinds in a minute. There usually is a person in the family, blood related, who has that type of anxiety or a type of anxiety, who is there a lot. Could be an uncle that came to live with him, could be a mother, father, whatever, but there is that element involved. So you got two things when I'm saying that. You've got the blood related hereditary factor, but you've also got the eye and the seeing and the learning from the person. And then you've got to have, in my opinion, this personality, this that I just described, about type A, perfectionist, sensitive, etc. That has to be there, or else, in my opinion, the panic disorder doesn't come. If you look at anxiety like a surname, your name is Gonzalez, Smith, Jones, whatever, like a surname. You got generalized anxiety, panic disorder, obsessive compulsive, post-traumatic stress disorder, phobias. All those are anxiety. They're all under that. And under anxiety, you can have school anxiety, separation anxiety. Oh, just go on and list and list and list. But to me, it's anxiety, and it's treated the same way, basically. Not the same way as depression, but it's treated the same way as the other anxieties. Medication is the same. Comments or questions? Yes?
I know when you said mind, spirit, and emotion, when you look at the last 50 years, especially our education system, and then you see what's happening even at our community at large, is the lack of, families really getting involved in just the raising of that spiritual aspect of that child. One of the reflections that we really see is, it's just so challenging because you're there at the public school system, but yet the lack of.
Yep.
And I see so much more children and adolescents being recommended for support, but yet we are really lacking the spiritual.
I'm a supervisor of those who want to be licensed professional counselors, and right now I have an intern that works in a school that works with little children, 5 years old, 4, 6, etc. And I hadn't worked with that population in a long time, but when she talks about these little children, I'm saying anxiety, anxiety. Do all of them have anxiety? Everything you're telling me is anxiety, but this little child is doing it's anxiety. So yeah, I would say there's the burdens and the losses are there, and the stressing is there. Medication is an antidepressant for depression or anxiety, works on both. Okay, you don't change it. For panic disorder, sometimes you have to use benzodiazepine, which is Xanax, Valium, those type of things, and they do help, but they're temporary. Yes, those are addictive, but like I said before, you got to have the personality to go with it. And addictive means 2 or 3 milligrams a day of, say, Xanax, and what they usually prescribe is a 1/4 milligram 3 times a day as needed. And so that the risk of it is low, and of course the people who are taking it, they're not going to go that way. And it's Prozac, Paxil, Zoloft, Celexa, Cerazone, Effexor, Wellbutrin, all of those are antidepressants, and any of those medicines will help. However, the anxiety person is very sensitive, and so you start with a much lower dose. Like if you're going to give, say, Paxil, which 20 is a therapeutic dose, you would start with, say, 10 with that person. If Zoloft can go up to 200, you start with 25. and so on for the anxiety person, because they're very sensitive to medicine, and it's going to affect them a lot quicker and a lot stronger than a person who doesn't have this type of anxiety. Questions or comments? Yes?
Say someone does have the type A personality and they begin to feel, overwhelmed. What are things that they can do to?
Not for depression, okay, but for anxiety, perfectionism, type A, overwhelming the burdens, etc. Not for depression. Romans 6:13, Romans 6:16. For instance, Romans 6:16 says that we become slaves to whatever we obey. Whatever we consistently obey, we become slaves to that. So the person consistently obeys doing certain things, like for instance, walk into a room, you went there for something, the room is out of order, you fix it, and then you go back to what you were doing before, and then you go get something else, and you see something else out of order, you fix it. I'm saying disobey these things. You walk in there, you see the need, you walk out. Disobey these things. There's other things to do, I can't get into all of the examples, but you disobey that which you automatically normally do. There's an impulse that comes up to the anxiety person that says, do this, and you disobey that thing. You're going to jog for a mile, your anxiety says you got to do 2 miles, do more, you disobey. You're exercising, you're lifting 50 pounds of weight for 20 repetitions, your anxiety says increase it, you disobey. You see what I'm saying? You disobey, because the mind of the perfectionist, anxiety person is going to want more and more and more and more. Your brother needs help, this is the 100th time he's called for help, you've helped him 99 times before, disobey. Leave it alone. Turn him over to God. See what happens. Disobey. Because that'll break the hold over it. We can get a lot more technical and personal, when we're talking one-on-one, but that's the general idea. And I am out of time, and I thank you. God bless you.